I've heard lots of women say you shouldn't go to the hospital until maybe you're 3 months pregnant. That's when it makes sense. Is that true?
Well, WHO said you should be in your first contact actually should be within the first 3 months of pregnancy, maybe between 10 weeks and 12 weeks. But we can see patients earlier if there are risk factors that are already identified. For instance, a woman who has had a bad obstetric history. Okay. She's been pregnant for several times with no baby to show.
So you might ask her to come earlier. There are some reasons, you know, that women give for not going to the health facility.
Okay.
I looked them up in the National Demographic Health Survey 2013. Yeah. And I was surprised to see sudden birth. They say, oh, the baby came too quickly. I didn't have time to come. Does that happen?
No, well, but baby is not supposed to come quickly. Baby gives you 9 months. You know, that's not an excuse.
No, but how about the giving birth, the day she actually has the baby?
Yes. A woman who has been exposed to antenatal care, one of the things that you do for her during her contact with you is what we call birth preparedness. This woman is taught about the signs of labor. You don't just go into labor. There are processes.
So that could be the problem.
Yes.
Some people don't even know.
So they don't know because they are not aware. Even though they are in labor, they are still at home. So one of the things antenatal care will do for you is to prepare you for delivery. So you know the signs of labor. You've identified where you're going to deliver. You've made preparation for the money and the resources that you're going to use for that delivery, including transportation. So once the signs begin to come up, a woman is supposed to present at the facility where she is receiving antenatal care, and so birth is not going to be sudden. Yes.
Some others have cited cost, about 8%. I was even pleasantly surprised that it was that low. I thought a lot of people complained about money. But what do you think about our situation now in this country? Is it costly for a woman to have a baby?
Well, I would say yes, I would say no. I would say yes. Okay, let me say no first, because of course you're looking forward to having a child. I don't think there is any amount that you can put as a premium on having a child. But yes, because Nigeria is still doing out-of-pocket payments, you know, where, you know, you pay for everything. Unlike in other climes where you have any of those national health insurance schemes that take. So sometimes a woman is pregnant, she expects that the pregnancy is going to last till 9 months. But because of risk factors, this baby is coming earlier than 9 months.
And then she's not prepared.
And she's not prepared. More so, she had thought that she was going to have a vaginal delivery. Meanwhile, in the course of pregnancy, there were now obstetric indication for a cesarean section, which is more expensive, you know, than vaginal delivery. That becomes a challenge.
Okay, now in other climes, some women give birth at home. They say they had a home birth. Why is it not popular here? Because some people will cite that, after all, they give birth at home abroad. Why shouldn't I have my baby at home and save my money?
Now, in those climes that you're talking about, we have community midwives. In fact, in those climes, the midwives do most of the work. You don't necessarily have to be in the hospital except it is indicated. But these midwives are trained. They even offer antenatal care in homes. So the woman doesn't have to come to the hospital to be antenated. She receives care in her home. But the government there is investing on personnel. So you have nurses that are working at community level. You have an arrangement with them, including your insurance package that you have. They come to you at the place that is most convenient for you. And if there are no complications, you can deliver at home.
These midwives,
yes.
How much training do they have? Because people would argue that there's somebody who helps all of us have our children in this community, and she's good.
No. The midwives that we're talking about in these climes are nurses who went into midwifery.
So they are nurses already?
They are nurses, they are midwives. Now, unlike in our own climb here where you have traditional birth attendants, these guys are not trained, as it were. They are not skilled birth attendants. Yeah, they may understand the arts, but they don't understand the physiology. So when there's a problem, because good practice should be, in the process of carrying out my act, to be able to identify problems and to, you know, offer referral as soon as possible.
So in other words, they can go through the motions, but they don't know why anything is happening.
They don't, because they are not formally trained for it. You see, medicine is an art and science. You know, the arts you can get anywhere, but the science behind everything. Why should a woman A be seen, and I say, okay, no, this woman can have a vaginal delivery, and I see a woman B, you know, and say, no, a vaginal delivery is going to be a threat to both your life and that of your baby. You know, that is the science, understanding the physiology of pregnancy, of delivery, of preparum, which are the things they don't have. That's the difference. And then you see their referral system there is smooth. The midwife is not working on her own. She's connected to a GP, you know, to a hospital. So if there is any problem, the ambulance services are effective there. Communication is effective. Within split seconds, a woman who is, you know, taking delivery at home, who has problem, maybe start bleeding, can be immediately moved from a point A to a point B. We can't say that in Nigeria.
Okay, so,
yes.
so that is
yes.
a no in our
For
own,
now, no.
For now,
yes.
But we're hoping that.
We hope we'll get there. We need a lot of personnel. We need commitment to it.
Let's go on a short break. We'll be back. Stay with us. We're coming back right after this.
Okay.